right, here is the fourth video in the series of 7 videos where we're learning how to chart our cycle, how to track our cycle, which we're using for natural family planning, we're using for natural method of birth control, we're using as a natural way to achieve pregnancy or to figure out what our body's telling us. We're using it as a way to achieve reproductive health and to read what doctors are calling our 5th vital sign. This video is about the most fun topic, cervical fluid. Yay! Okay, not really. So when a friend of mine and I used to host these mornings where we talked about this, we used to have brunch, invited everyone, all the ladies over for super yummy food, and it was so fun. Like, I loved doing it because we got to sit and have conversations and we got to laugh, and this part was a little bit awkward at first, but then kind of laughed and made it lighthearted. So just pretend that we're doing that now and it's not awkward. And let me tell you why it's really not awkward. It's because every woman experiences this. And I wish I had known that when I was a teenager. Because naturally, every cycle, my body produced cervical fluid. And I had no idea when I was a teenager what in the world was going on. I thought something was seriously wrong. Seriously wrong. I also experienced ovulation pain. Down in my lower abdomen, it was excruciating every month. And I thought something was terribly, terribly wrong with me. Come to find out, it's all a normal part of the way my body worked every month. And you may experience ovulation pain as well. Most women don't, but you may be one of the odd ducks out like me who did. However, in this video, we're going to talk about cervical fluid, how to read it, and how to understand what it's telling you. Okay, so we're going to go back. Those of you who are doing coaching with me, we're going to go back and reference the whole cycle graphic. And now you're going to notice that there is a line here in the middle. Right there in the middle, we're charting cervical fluid. At the first part of the cycle, so right after menstruation, right after your period ends, the first part of the follicular phase, you're going to notice that it's dry. There should not be, hardly any, cervical fluid. You are going to notice, though, that your body starts to produce cervical fluid. Now, this is something you're going to measure, or you're going to track every time you go to the bathroom. Whenever you wipe, you're going to notice it. What is the sensation when you're wiping? What is the fluid that you're getting on the paper? You're going to keep track of that. And whatever is the most fertile, which I'll explain how to tell what that is, whatever's the most fertile that you've tracked that day, that's what you're going to put down for that day. You're going to notice that it comes up to this insane amount. For some women don't notice an insane amount of cervical fluid. For me, I notice an insane amount of cervical fluid. And then it's going to drop off and go to dry again until your period starts. You may notice a couple wet days before your period starts, your body building up to it. But in general, your luteal phase is going to be dry. All right, so let's learn how to track it and what the fluid actually means and how to tell when it's a problem. So first of all, go ahead, grab your pen, your paper, take notes. Some of the things that we're going to talk about first are the things that mask fluid. So be aware of this list of things and realize that these things can throw off what you're noticing in your cervical fluid. Things that mask fluid are infections. So if you have a vaginal infection, that's going to throw off your cervical fluid. Douching, seminal fluid, arousal fluid, spermicides and lubricants, antihistamines can also mask your normal cervical fluid. So keep that list, make sure you have that in the back of your mind so that when you are checking your fluid, you know if any of those are a factor. Okay, let's talk about the stages of normal fluid. And then that's going to give us a clue as to when it's a fluid that signals an infection and when it's abnormal and when to go ahead and see a healthcare provider about it. Normal fluid, let's talk about it. So right after your period, like we said, in that part of the follicular phase, no cervical fluid. So the sensations that you're going to notice are dry and maybe slightly damp. Maybe slightly damp is because your vagina is flushing out any of the bacteria that's not good to be there. It's flushing it out on a daily basis. So you may notice that it's slightly damp. If you're getting any fluid, like if you had it on your fingers and it dissipated or it dissolved, it kind of evaporated, that's not cervical fluid. That's other fluid. That's not what you track. The cervical fluid that you're going to be tracking is stuff that would, if you were to touch it with your fingers, would stay there. I know it sounds gross, but this may be the best way to get to know your body and what your cervical fluid is telling you. When you see the cervical fluid, go ahead, stretch it out, feel it. What does it feel like? You'll be able to notice it just by sight after a little while. Okay, your cervical fluid is then going to build up during what we call the fertile phase. Remember, that's ideally 4 to 8 days, acceptably 1 to 10 days. You're going to notice this buildup of fluid. It goes from sticky, which is described as sticky, crumbly, rubbery, or gummy. It's you can kind of roll it back and forth. It's going to build up from sticky to creamy, which is more like a lotiony or milky texture, to egg white, which is described as slippery, clear, stretchy, streaked, clear. Any one of those, as long as it's like egg white and it's super stretchy. This is the fluid that's super stretchy. It's the fluid that when you go to the bathroom and sometimes it may have pooled in your underwear. That's totally normal. That's what used to freak me out when I was a teenager, but it's totally normal. This is your most fertile fluid. And the reason for this is that sperm has to have fluid to get to an egg. It has to have a transportation system. Sperm can't walk. It has to have something that takes it there. So if you don't have cervical fluid, you are not fertile. Okay? We have one exception to that rule in the birth control series, in the birth control video, and I'll explain why there. But as a general rule, if you do not have fluid, you are not fertile. When you are tracking your fluid for the first few cycles, until you get to know what your body is telling you, then you need to just use that time. Again, like I said over and over in the temperature video, just use that time to get to know your body and what it's telling you. Okay, so then ovulation happens and it immediately becomes dry. You may notice that your temperature shifts, so you're like, oh, I ovulated, but then you still see the egg white the next day. What's up with that? Or maybe you stay slippery, you get a slippery, wet feeling, like a very lubricated feeling. And then you would still know, oh, I'm still considered fertile, but I should have already ovulated. And an egg only lives for 24 hours. Some women have eggs that live for 48. We'll talk about that more in the birth control video. So you have to go we're going to talk about this more again in the birth control video, but you have to go off of your fluid, not your temperatures, for family planning. Okay, typically it will become dry immediately after ovulation. And then again, you may notice a wet sensation appearing right before your period. All right, so each woman has your own pattern. What I just described to you is a typical pattern. You may notice that you have a slight buildup, or you totally skip the creamy part, or you totally skip the sticky part, or you don't notice egg white, you just have a very lubricated sensation. You need to figure out these first few cycles, what is your normal pattern? There are abnormal patterns. And if you're coaching with me, we're gonna help identify, whoa, that's abnormal, this isn't normal, this is off. Okay, there are some abnormal patterns and those are going to be different and they're going to signal different things. For example, you may have patches where it's like your body's trying to ovulate. It's your estrogen is rising and so it creates all this fluid and then it backs off and it didn't happen. And then it tries it again. And so you'll notice patches of it like egg white fluid or lubricative sensation, but then you may never even ovulate, or it may take a while and you finally ovulate. Those are things, if you're getting coaching or you're talking to a healthcare provider about it, they're going to be able to provide more insight. If you get to know your body, you may have an odd cycle where that happens, or you may find it's just an odd cycle and then you go right back to normal, or you may find that is normal and that's when you're going to need to talk to somebody. Okay, so let's go ahead and talk about abnormal fluid. So abnormal are when it is gray when it is green, when it's foamy, when it has a cottage cheese texture, when it's itching and irritable, it irritates you, when it has an unusual or foul smell, when it also is accompanied by discoloration and redness, or when it's accompanied by swelling, or if you're having spotting with fluid, with the exception of spotting around ovulation. That can be normal for some women. However, if you're constantly having spotting throughout your cycle, not just at ovulation and not just during your period, then that's something to talk to a healthcare professional about. So now you know what typical normal fluid is going to be like for you, and you know what abnormal is going to be. Now, the question is, and so here I've listed, so if you go back to the cycle chart, and you're going to notice I've kind of listed out those sensations, the feelings for you down there below. And so then back to the question I get is, what about yellow? Yellow can sometimes signal an infection, but it has to be accompanied with usually redness or swelling or uncomfortableness or a foul odor. If it's just your typical, it's yellow, it's just a normal everyday cervical fluid, it's nothing to worry about. It's nothing to rush off to the doctor about. So every time you get cervical fluid, and you're going to notice it happens monthly, it's not an infection. It's actually your body providing a normal way for sperm to implant in an egg. Now, if you're not trying to achieve pregnancy, we're going to talk about that in the natural birth control video. Cervical fluid is going to be your key. Now, there are women who track just cervical fluid. They don't do temperatures. I don't think that's as helpful of an overview picture, because temperatures are a huge key as to knowing whether or not you ovulated, or thyroid health or progesterone health, things like that. However, it is totally possible to just track fluid. When you have done this for a little while, you may even not track temperatures until you start to see a wet cervical fluid or a fertile cervical fluid. And so once you've gotten used to what your body's doing, you may not have to track temperatures as much. However, this cervical fluid is going to be your key to your reproductive health.